Scope and limitation of homeopathic mater medica. Homeopathic mater medica is a collection of specific record of homeopathic remedy which are proof on healthy human being on both sexes and different ages. It is encyclopedia of the therapeutic property of medicinal substance. Homeopathic system of medicine is a completely based on the scientific and logical experiment, explanation and proving record. Homeopathic mater medica have various scope which help in practicing homeopathy and certain drawback too. Scope of homeopathic mater medica. Holistic approach. Homeopathic system is based on holistic and individualistic approach. In homeopathic, holistic means that the treatment of a person is done as whole, consider mental, physical, social factor rather than just the symptom of disease. So there is a holistic approach found in homeopathic mater medica. Proving on human being. Homeopathic drug are proved on healthy human belong which is not found in other system of medicine. Complete and essential knowledge of the action of drug substance can be obtained by proving on human being. Subjective symptom can be known. Collection of subjective symptom. Subjective symptom are those symptoms which are felt by the patient himself. Homeopathic mater medica is filled with such symptoms are after proving on healthy human. This helps while attending the cases. Accuracy and rationality of symptom. All the symptoms in mater medica are recorded without any modification in prover sensation subject symptom. They are written in word of the prover. Even the sequence of the appearance of symptom are mentioned. Verify and confirm symptom. The symptom obtained for healthy prover are written only after the confirmation by the reproving and verification of sick individual. Large number of medicine and symptoms. Homeopathic mater medica contain number of medicine with wide range of symptoms. These help in selection of most similar medicine from each individual case. Selection exact similar. Homeopathic mater medica are selected on the basis of similinum. Due to the extensive range of symptoms, it become possible to find the most similar remedy to the patient totality of symptoms based on the individualistic characteristic. Evaluation of miasm become easy due to vast collection of provide clinical record. Homeopathic mater medica help in order to evaluation the underlying miasmatic background. Help while case taking. We can collect most accurate symptom from the patient by formulating the question according to the knowledge of symptom in homeopathic mater medica. Can find suitable prophylactic remedy. We can select homeopathic prophylactic remedy suitable for individual property with the help of mater medica by studying person's temperament and the assesses it. Limitation of homeopathic mater medica. No proving record of pathological changes. There are no proving record of pathological changes in homeopathic mater medica. The drug were approved before any pathological or organic changes took place. Lack of reliability in proving. Many provers who voluntarily participate in homeopathic drug proving were non-medical people. So it is possible that important symptom may get neglected by the prover unknowingly. Lack of subjective symptom. Homeopathic mater medica is filled with subjective symptom. Objective symptom are those where can be perceived by other than the patient, such as pallor, rapidness of pulse, rapid showing, respiration, etc. This system can be evident for the disease diagnosis. Homeopathic mater medica do not have extensive range of objective symptoms. Limitation for emergency cases. Homeopathic mater medica have limited scope for acute emergency cases like congestive cardiac failure, shock, accident case, and poisoning, etc. Difficult to remember all the symptoms. Vast number of medicine symptoms make it difficult for human being to recall all of them. Limitation for surgical case. Home has very little scope in field of surgery, anesthesia, contraception, etc. Particularly drug, partial product. These are some partially proved drugs due to which it is become difficult to utilize them due to lack of records.